we we all know in like for the past centuries, like country like China, they have experienced so many pandemic. That's why the world called them the fourth leader, the pioneer in herbal medicine revolution. They are the fourth leader. They did a lot of research, and during COVID, they used medication that helped them treat MERS-CoV that the world experienced like maybe like 20 years ago, SARS-CoV-1, and most of the COVID coronavirus disease that happened in the world for the past centuries. They have, I would say, developed some medication, plant-based medication. The word is kind of hard to pronounce, but we did some like literature review on them, and we have some more specific the one they use. But I'm not gonna spend too much time on them. This one, these two, I'm just gonna say like just a little something about them. Attending from teaching hospital in China, they did some in vitro and in vivo study. And with those medications, this is what they find out. I'm just gonna read that for you. Okay. For Shufeng Jedu SFJD treatment, partial pressure of oxygen, what we call partial oxygen pressure in the lungs, tissue increase. The level of lactic acid, inflammatory cytokines such as interleukin 1B, interleukin 6, and tumor necrotizing factor, they kind of inhibited. What does that mean? This means the cytokine storm that we experience when we have COVID, the inflammatory response, this medication will slow it down. Also, in the same articles, it says many Chinese doctors believe LHQW, I'm not gonna pronounce this one, as the protein, this is B, to bind with the ACE2 in the cell wall and stop the cytokine storm. Increasing evidence has proven that cytokines are responsible for causing fatal pneumonia. And we know the pneumonia, that's the number one problem that COVID brings with it, where the gas exchange is not happening, the oxygen can't get in, and now the CO2 stay in the system, causing, I would say, more problem. The patient become acidic. And also in COVID-19 patient treat with LHQW, after a total effective rate 74.55%, and 28 patients were cured after 3 days. After 3 days. After 7 days, the treatment, the total effective rate was 92.73%, and 39 patients were totally cured. The primary symptom patient experience, the symptom of COVID, we know them: fever, high fever, coughing, fatigue, body ache, and chest tightness, what we call the status asthmaticus, were significantly reduced. This is beautiful.